Assalamu alaikum. I'm Dr. Usamah bin Waheed, postgraduate trainee at Department of Neurosurgery, Civil Hospital Karachi, SMBB Trauma Center. So I'm going to talk about comparison between the demographics of adult and pediatric head trauma. So here are some facts. Traumatic brain injury is an epidemic in this post-industrialization area. The annual global incidence of traumatic brain injury ranges from 91 to 546 per 100,000 patients. The affected victims are mostly males in their second and third decade of life, who are usually the breadwinners of their family. In pediatric patients, trauma is a significant cause of mortality and disability, accounting for a greater number of deaths for all the diseases combined. Not many studies are available for the epidemiology of pediatric trauma. Effect of head injury on children is different as compared to adults, since their brains are in active phase of growth and the fluid content is higher in comparison to the adults. So the objective of our study is to determine the epidemiology and to compare the demographics of both the patient, pediatric and adult head trauma, to get a better understanding of the variability in the mechanism and responses to head injury in each group, and to develop preventive measures and better management guidelines for both the groups individually and combined. The study was conducted at the Department of Neurosurgery, Civil Hospital Karachi, SMBB Trauma Center. The study started from 1st November 2017 and ended at 31st October 2017 with a duration of 1 year. As per institutional protocols, CT scan brain were already carried out for all the patients before the neurosurgery consult. The patients referred for neurosurgical consult from the emergency department physicians between the age of 1 year and 60 years were included. Patients below the age of 1 year, that is infants, and the above of 60 years we regarded as geriatric population were excluded from the study. And then we divided the patients into two groups. Group A was designated for the adult population that ranged from above the age of 13 years to 60 years, and the group B for the pediatric population that was 1 to 13 years. Records of all the patients were collected from the hospital data records and were recorded on a pro forma. Special attention was given to presence of the injury to thorax, abdomen, extremity, maxillofacial injuries that were proven by the radiological evidence. So as for results, we had a total number of 4,640 patients that were included in our study. 3,202 belonged to the adult group and 1,438 belonged to the group B, that was pediatrics. The male to female ratio in adults was 5.15 to 1, and in pediatric group was 2.21 to 1. So here is the patient distribution. Almost a 3:1 ratio exists in the pediatric and the adult to pediatric patients. Here we can see the male dominance is in both the groups, but in pediatric population, female patients are more as compared to the adult population. As for the mechanism of injury, what we figured out is the most common mechanism of injury in adult population is road traffic accident involving the motorcycles. That was followed by fall. And conversely, the most common mechanism of injury in pediatric group was fall, followed by the road traffic accidents. And rest were mechanisms were almost similar. One thing to give attention to what we found in our study is that the assault is less common in pediatric group as compared to adults. We divided the patients into mild, moderate, and severe on the basis of GCS. A huge number of patients presenting to us belong to the mild brain injury. But as we see here, that the patients in the belonging to moderate and severe group are more in adult population as compared to the pediatric. We took an account for some danger signs, that was loss of consciousness, vomiting, event amnesia, ENT bleed, etc. We figured out that loss of consciousness was the most common presenting complaint in adult population, followed by vomiting. On the contrary, the vomiting was the most common presenting complaint in the pediatric population, then followed by adult loss of consciousness. So the group A is adult and group B is pediatric. So this is a tabulation of CT scan brain findings. A huge number of patients in both groups had a grossly normal CT scan without any findings of intracranial lesion. Then we see that the linear fracture is the most common finding in both the groups. And some things different here are that contusions are more common in adults as compared to pediatrics. And another thing to pay attention to is that acute subdural hematoma and subarachnoid hemorrhage is significantly higher in adult population as compared to the pediatric. Irrespective of the volume and location, extradural hematoma was observed in 13% of the patients in group A and 8.3% patients in the group B. Extradural hematoma was present in 40.2% of the patients who had a linear fracture in group A, whereas it was found in 23.5% patients of group B. This is the count of other injuries. Here we can see that extremity trauma is fairly more common in adult group as for the facial injuries as well. And for our data for the head injuries, which we included the patients for head injuries, we were unable to find any pediatric patient with an associated spinal injury, although we had 1.8% patients in the adult population who had radiological evidence of spinal injury as well. So as for the outcome, predominantly most of the patients in both the groups were immediately discharged after giving the initial treatment. The retention rate for 24 hours, less than 24 hours, is more in pediatric group as compared to adult, whereas the 26% patients were in adult population, that is group A, were admitted for surgical or non-surgical management as compared to 16.7 in pediatric group. So as we conclude here, that the fall is the most common mechanism in children. Adults are more prone to accidents, motorcycle being the most common mode. Incidence of severe brain injury is significantly higher in adults as compared to the pediatric group. Hemorrhagic conditions are less common in children than adults. Due to flexibility of spine and laxity of ligaments, pediatric patients suffered lesser injuries to spine compared to adults, and so do they sustain lesser facial injuries comparatively. So understanding the differences in the mechanism of response to injury in different age groups is of utmost importance. Separate trauma management protocols of each group should be devised and practiced to save critical time and meticulous management. Proper training of emergency department physicians for the management of trauma should be mandated even at the primary and secondary care centers. Awareness sessions about trauma, its mechanisms, and prevention should be conducted for the general population. Further research involving larger population, multiple tertiary care hospitals, and further division of population groups based on the demography needs to be encouraged. Multidisciplinary researches need to be promoted for the improvement in systematic understanding of trauma as a whole. These are the references. Thank you. I would like to have the advantage of this 1 minute 20 seconds. And this is a flyer or a pamphlet that we have devised at our Department of Neurosurgery that will be handed over to all the patients that are being discharged. So it includes, first of all, sar ki chot lagne ke baad ki hidayat, that is the instructions after the head injury. For the first part, it is printed in 2 languages. One is the Urdu that is universally accepted in Pakistan, and is Sindhi since we belong to Sindh. So it shows simple descriptions about what you are going to face after, what are the danger signs, what things you have to pay attention to, what are the signs that you have to come back immediately to the neurosurgical care. And last section is given to the prevention, that how you have to prevent. So in this, there is a pictorial representation of as well. Since we find out the fall is the most common mechanism in children, so we have mentioned that the open. Since it's not yet printed, we will need your advice for improvement in this. So if anyone is interested, we can give a soft copy so that they can give their feedback for the improvements. Thank you.